welcome to another episode of Going All In, Get the Edge You Need to Succeed. I'm Dr. Erin McKinley, and today we have another awesome spotlight session with Alegria Cohen from the Hebrew Rehabilitation Dietetic Internship based in Boston, Massachusetts. All right, welcome to the podcast, Alegria. To get us started with this episode, I would love for you to give us a quick introduction to you, your journey to RD, and how you landed in this new position with Hebrew Rehabilitation.
Thank you so much, Erin. Yes, so my background originally is I have my bachelor's in biology from Binghamton University in upstate New York. And I decided that I really enjoyed the GI track, that portion of biology so much. So I decided to pursue a master's in nutrition. I moved from New York up to Boston, and I have my master's in nutrition from Framingham State University, and I did a coordinated program there. And following my coordinated program, I got hired. I've actually been at Hebrew Rehabilitation Center for a little over 10 years now. I've worked on all levels of care that we have here, which I'll go into in a little bit, and have worked I've worked to the clinical dietitian, the lead, and now within the past couple of years, program director. So kind of using all my experience throughout my time here at Hebrew Rehabilitation Center to build this program.
All right. Well, I'm going to let you jump into telling us all about this new program that you have.
Okay, thank you. So let's see, a little bit about Hebrew Senior Life. So that's the umbrella organization of Hebrew Rehabilitation Center. But mostly we'll talk about Hebrew Rehabilitation Center. So Hebrew Senior Life was founded in 1903. It serves over 3,000 seniors between all campuses. We have several different levels of care between all campuses, subacute, rehab, long-term care, assisted living, and independent living. We train over 1,000 interns annually. It's a Harvard teaching hospital, so we have geriatric fellows. We also have a lot of PT and OT interns. We are the 5th largest nonprofit organization in Massachusetts, and specifically to our department, we have about 15 years of experience precepting dietetic interns. So although this internship is new, the clinical preceptors have a lot of experience. We've taken interns from Beth Israel Hospital, Simmons University, and many distance internships. Some of our cultural beliefs that are really important to our organization were kind of thought of while we were building this program. One of which is that I want to focus on is this grow professionally. So we obviously want our interns to grow professionally, but as well as our employees. So all our preceptors, by becoming a preceptor, it really shows growth, that you're able to now teach what you learned. So just by having this program, we feel like everyone will be able to grow professionally. And obviously a lot of the other ones also kind of coincide with our goals for this program, leading the way. There's very few geriatric focused dietetic internships. So more specific to our internship, we have 2 tracks. We have a full-time track, which is 10 months. So that's from September to June, and we have 8 slots available. We also have a part-time track that has 3 interns for 20 months. So it's September to June, and you'll have summer break, and then September to June again. And that's 24 hours per week each year. So our mission statement is that we would like to prepare graduates by providing the highest quality training to create successful, passionate, creative, and competent entry-level dietitian nutritionists. The program will provide an emphasis in geriatric nutrition and food service management to help raise the standards in senior healthcare. Some rotation specifics. we have our orientation will be 2 weeks long. Since our interns will be here with us for so long, we want them to become oriented to the organization. So they'll undergo HSL orientation just as any other employee would undergo. Also dementia training, which is something that all employees have to do as well, because we have, a good amount of patients with dementia, and there's special training to be able to care for those patients. We will review our Meditech and Computrition, which are both software systems. So we want to make sure that you are very well versed in those. So that is something that you don't have to focus on your first day of your clinical or food service rotations. We'll also do some role playing because it's fun and you're going to have so many patient interactions. So we'll make sure that you feel comfortable with it. And then we'll obviously do the introduction to the nutrition care process using real experience, and we'll all work through a nutrition assessment together. Class days will be on Mondays. There's 22 class days. This is a day all interns will be together. We'll have various topics such as cancer, transplant, diabetes, all these specific topics, bariatrics, and we'll have some guest lecturers to come in. We will have our interns do their presentations for the nutrition care plan and their literature review during the class day, as well as some role playing. There's a project for role playing as well. The largest rotation is clinical. It's 15 weeks long, 32 hours per week for those for the full-time track. 5 weeks are long-term care. So these abbreviations are Newbridge on the Charles, or HRC is Hebrew Rehabilitation Center. So I actually apologize, I didn't explain. The two main sites that interns will be at are either Newbridge on the Charles or Hebrew Rehabilitation Center. Hebrew Rehab is the flagship site, and that will be the site that interns spend the most of their time on. There'll be 5 weeks spent in the rehab rotation. And then we also have a medical complex rotation, which is 3 weeks, either with us or at Brigham and Women's Faulkner Hospital, so acute care. There'll be 2 weeks of staff relief, and during this rotation, interns will have time to work on their nutrition care plan paper. So that's a real live patient that they find to be really interesting, and they'll share their nutrition care process and their findings and the follow-up and the progress of the patient with the whole class. So we've done that in the past with other interns, and it's really interesting, not only for the other interns, but also for the dietitians as well. And then there'll be food service rotation for 6 weeks, again, either at Newbridge on the Charles or Hebrew Rehabilitation Center. They will participate in lean training and do a project. Lean training is kind of trying to make processes more concise. And other projects that they'll work on is a special meal project, a menu project, and this whole rotation will not just be about, food production. There'll be a real focus on the management portion. And doing these projects is all something that we would be using in the future. Other rotations that are, Head Start is not on site. So the interns would go to a Head Start location for 4 weeks. And this way they'll be looking at the other end of the life cycle. Hebrew Rehabilitation Center, usually our population is it's mostly older adults, but obviously it's not preschool kids. So this way interns will be comfortable with all age groups. Interns will also spend 2 weeks in an outpatient setting, as well as employee wellness. So that is actually in-house. We have a director of employee wellness who they'll work with. She's very passionate about this program, and I'll speak a little bit more about the specifics and give you some examples of what she currently does. We also will have a 1-week research rotation. We just down the hall from the nutrition department is actually our in-house research institute that's affiliated with Harvard. Additional rotations, we have a rotation for National Nutrition Month, which is 40 hours. That whole week will be devoted to National Nutrition Month activities for both Newbridge on the Charles and Hebrew Rehab Center. I'll show some pictures of past examples of past March events. We also have a Plan Your Own, and that's a 1-week rotation. We have some sites set up. We have community servings, WIC, and different affiliates of Hebrew Senior Life, but interns can also choose their own site if they want more experience in a certain part of, maybe public health or maybe more bariatrics or something like that. They're able to set that up. Interns will get 2 weeks of vacation per year, December and April. We will actually pay for interns to attend the pediatric conference at Children's Hospital. And that's something that's been going for a while. When I did my internship, I attended the pediatrics conference, and it's great. So that's even more exposure to the younger population. Let's see, Day on the Hill in the State House is also something that I personally did as an intern. We continue to do so. One thing that we currently have our interns do that we get really rave reviews on is have interns attend wound rounds. Nutrition and skin condition really go hand in hand. So it's really a fun experience for the interns to have when we want them to be able to, for us to be able to provide that for them. Interns will also be able to watch an MBS, so a swallow study, and they'll work with speech. Again, we kind of work very closely because we have a lot of patients with dysphagia due to cognitive changes or dentition. So that will be something that they're able to do, and they'll also be able to participate in our journal club. So here's some examples, our real life examples of National Nutrition Month. This was a couple years ago. We've done annual food drives where employees from Hebrew Rehab bring in non-perishable items, and we donated them to our local food pantry. This is our nutrition fair for a couple years ago. Unfortunately, the past 2 years, we were not able to do our normal National Nutrition Month activities. But this was 2019. We had food demos, we had free food. It was a lot of fun. This year, what we were able to do is we were putting together a recipe book that currently marketing is working on. For me, it became over 200-page recipe cookbook. So it was a big hit. This is other past years. We had a board on allergies, and then this was a game that employees would play. This is quality improvement project that I worked on in the past, and this is when we looked at, it was kind of the beginning of the NFPE and documenting and coding for malnutrition. So this kind of, I looked at data from over the course of the year, and we saw that malnutrition was accurately assessed by dietitians, and even the documentation by MDs had improved. And this was back in 2018. I'm sure if I did this QI again, it would be even more, much more for the providers. They're doing a really great job. We have a great relationship with them here. This is part of that employee wellness rotation I was talking about. This is in the past, the director of employee wellness has done things for, Heart Healthy Month, for Employee Week. In the past years, she had a bike bus rented. So we were able to go on a spin bike, and it would just drive throughout the city of Boston. So that was a really, really fun experience that we were able to do. And we currently we're doing the walking challenge right now. It's very competitive. And last year, the dietitians in my office won, and they have this trophy that's sitting in our office, but I think hopefully they're able to, keep the trophy at home, but there's a lot of competition this year. Other things that we've done in the past, this is also in National Nutrition Month. We coordinated with culinary here. Food service and clinical kind of go hand in hand here. And this was a huge success. We did Iron Chef 2 years in a row. The first year we did, our executive chefs participated, and the following year we had a bunch of sous chefs. And it was really, really great feedback that we received from that. And this is just a fun picture. I included this picture because I think it tells a lot about our culture here. We just have this tradition in which we make cookies with our baker for the holiday called Purim. And the reason why we help them make cookies is because it's really very time-consuming process. So you see that we have to pinch all the cookies into triangles, and he makes somewhat 400 or 600 cookies. So it'd take him a long time. But this is one of the years. And now we have almost the whole office helping him. Some of our selection criteria. So for this year, there's the application is found online. We have openings for the fall, so we're not participating in DICUS this year. It's direct application. But next year, so for the class from fall 2022, we will be going through DICUS. So in addition to the application, we were looking at overall preparation, interpersonal skills, 3 letters of recommendation, and compatibility of professional goals with our program. Some of the benefits of our program are meals. Lunch is provided at most clinical and food service rotations, so that's always good. Registration fees for the Children's Hospital Pediatric Conference, free parking, discounted entertainment tickets, and professional liability insurance. Internship costs. So our cost for our program is $8,250, which includes this $1,000 deposit. I do want to share that we do have scholarships available for this year. So we don't know if those will exist next year. We have gracious donors this year. So I highly recommend people apply this year to take advantage of that scholarship. The Academy membership, the health insurance, these are all just estimate, and this all can be found on the website. So let's see, a lab. So we don't wear lab coats, but if you go to Faulkner, you'd need a lab coat. And the only book that we require is the NFP guide. And this, I just want to end with this because everyone when you're in the internship, it seems like a long time, but we really don't want it to feel like that. We want everyone's time here to be fun, interesting, feel like they're doing something that is worthwhile, and learning, doing the projects that they'll do that will be used for the future.
All right, perfect. Thank you for that overview. I'm going to jump right into the 5 questions that I ask all programs that come on the podcast. And these were put together with the help of my students here at LSU. So they're definitely questions that students like to know the answers to. So looking forward to this first round of applicants coming through, what is one thing in particular that you're really going to want to see on those letters of application?
So what I would want to see is something that sets the student apart. I would also like to see that connecting to the organization's mission. So how those two things connect, and the ability to put that into writing is really something that I would love to see.
All right. So thinking about resumes, there's a lot of rumors that go around about resume length and what it should look like. So in your opinion, do you think an applicant's resume should always be 1 page, or are you flexible with a little bit longer depending on their experience?
I think it's definitely flexible. I would hate for an intern or anyone really ever to feel the need to squish it into 1 page. Sometimes I always tell people I don't want them to sell themselves short. if you're trying to cram it into one page, sometimes you'll only mention the job title, and the big picture isn't, you can't really say that all in one title. So an example of when I was younger, I actually worked at Cold Stone, which whenever I tell people that, they always laugh, like a dietitian working for Cold Stone. But I was not a dietitian just yet. So working there, not only if I just said, oh, I worked at Cold Stone, I would have been able to say, you know, I knew about food temperatures and allergy awareness, and perhaps I had a leadership role there. So if you're able to bullet point that out, you'd get more, it would be beneficial for the applicant.
Right. So what is one or more things that an applicant may do, and this could be in the application itself or in some sort of correspondence that you have with them while they're applying, something that they may do that might raise a red flag for you to make you think maybe this person isn't the best fit for this internship?
I think just in general, poor engagement. If it's like, if it's face-to-face or on Zoom, poor eye contact, not asking questions. I really enjoy when applicants ask questions. It shows that they're more involved, more invested, and if they also don't understand our program mission, if they kind of mention that they're not fond of the field of geriatrics, that would be a little bit of a deal breaker.
So what is one thing about the program that you really feel separates you from the competition?
The main thing that separates us is there's very few programs that have the geriatric focus in it. That being said, it's not all just, long-term care. We have all different types of clinical care. We're not a nursing home. We are a teaching hospital. And then another thing is the research facility that's on site.
All right. Well, my last question of the 5 is a 2-part question. And the first part is, what are the 3 best adjectives, and they could be descriptors or phrases, to describe your program overall?
I think for our program, I would say passionate. So not only what was all the hard work and passion that was put into creating the program, but also just the RDs that are currently working here are very passionate about what they do and the patients they care for. Another adjective would be unique. Again, the geriatric focus is not seen very often. And then motivated. So not only from, again, many different tiers, all, not only myself, but everyone who's helped start up the program all the way up to the CEO of our company has been very motivated to make sure this program is a success.
All right. And the second half is very similar. The 3 best adjectives, descriptors, or phrases to describe your ideal applicants.
So I think 3 would be motivated, just like us. We want our interns to be motivated, professional, and then open-minded. Being a new program, we have everything set, but there might be some changes along the way. So having someone be open-minded would be really beneficial, especially our first year.
All right. So I just have a couple of extra questions that I thought of while we were presenting about the program. So for those that you're looking for this fall, they have to have a DPD verification stage.
Yes.
Do they have to already have their master's degree done?
No, not this year. The master's requirement is 2024, I believe.
So are there plans in the future to kind of alter the application requirements to only really look at those who have master's degrees after that deadline?
Yes.
Gotcha.
Yes.
All right. So how do you plan to integrate RD exam review into the program?
The last, for the class day, that will include RD exam prep. Our last few class days, we'll do, I use Gene Inman, but I know that there are several other sources now, but all of that will be reviewed during class days.
All right, perfect. Well, that's all the questions that I had today. So I would love to close out this episode with a quick take-home message from you to potential applicants this year?
So we still have open slots available. Just because you didn't match in the spring doesn't mean to give up your dreams of becoming a dietitian by 2022. We have a great program here. We are passionate about what we do. We have a lot of fun while we do it. And we also have scholarships. So I hate to say it, but this year we do have scholarships available. So have fun. And we really are excited to start off with our inaugural class at Hebrew Rehabilitation Center.
All right, awesome. Thank you so much for joining me today. And for those at home who would like some more information about this program at Hebrew Rehab, I've included the web link to their program in the description below this video. And as always, don't forget to like this video and subscribe so you never miss an episode with another awesome and brand new dietetic internship program. And we'll see you next time. Yay, that's it.